Dear viewers and readers, welcome to this special program of Daily Ajker Patrika. I am Mohamed Shofiullah. Today we are at the country office of the World Health Organization in Bangladesh. Joining us is Dr. Ahmed Jamsheed Mohamed, the WHO representative to Bangladesh. Dr. Mohamed has been serving as the WHO country representative in Bangladesh since 1st November 2024. Prior to this role, he served as the Deputy WHO representative in Bangladesh. He brings over 18 years of experience in public health and has been working with the World Health Organization since 2013. Today, we will be discussing key public health issues in Bangladesh, including WHO's priority in the country, challenges in health system management, emerging public health concerns, the prevention and control of communicable and non-communicable diseases, immunization, the One Health approach, universal health coverage, and the other contemporary health issues. Assalamu alaikum and good afternoon, sir. Thank you very much for joining us today. How are you, sir?
Thank you for having me. I'm doing very well. Thank you.
Thank you very much, sir. You are serving as the WHO representative in Bangladesh. Following your previous role as deputy representative, how would you describe your experience so far and what key health realities have stood out to you?
I have enjoyed my time in Bangladesh, both in my earlier serving in 2021 and 22, which was a very different environment back then, in the middle of the pandemic. I have really enjoyed the pleasant, warm people of Bangladesh, very friendly, very hospitable. So overall, I think it has been a good time. In terms of the health sector in Bangladesh, I think Bangladesh health sector has this paradox of two sides.
Okay.
On one hand, there has been many achievements, important achievements. The people in Bangladesh are living longer.
Yes.
Maternal and child or infant mortality has been going down.
Mm-hmm.
Bangladesh has successfully either eliminated or controlled many diseases, including polio, lymphatic filariasis, Kala Azar.
Mm-hmm.
But on the other side, Bangladesh health system is also challenged by many factors, including low or poor investment in public health system, inadequate workforce for health across the country, and availability of medicines and diagnostics, especially in the rural health settings. So there's this paradox of both good and not so good sides.
Yes. WHO collaborates with the government of Bangladesh on various public health issues. Which health priorities currently require the most attention, and where do you see the strongest progress in Bangladesh?
WHO works within the country side by side with the Ministry of Health and other stakeholders in providing a range of support in public health. It is policy support, technical support, capacity building, and many more. In my opinion, where the comparative advantage of WHO is and the need of the country, we really need to focus on, especially on two areas.
Yes.
One is supporting the government in strengthening primary health care to make sure that universal health care is achieved, that no one is left behind. And this actually has a very diverse range of support that government would need, where WHO will be working together with the government. I think moving forward, the other important area where we really need to focus is the rise in non-communicable disease burden in the country and addressing that.
Yes, I want to say something about that, sir. Not only Bangladesh, but also in planet, whole world, face a growing burden of non-communicable disease such as diabetes, hypertension, heart disease, and cancer. For WHO perspective, what are the main gaps in prevention and control, and how is WHO supporting the government to address those type of public health crisis.
Yes. If you look into Bangladesh data, as you rightly mentioned, this is a trend which we see in the region and globally. 71% of the death in Bangladesh at present is because of non-communicable diseases. 1 in 4 adults in the country is having high blood pressure. 11% of the adult population is having diabetes.
Yes.
These are the figures that we know. We also know that there are many more in the society, the community that we don't know their status. If you look into the risk factors associated with non-communicable disease, whether it is cardiovascular disease, hypertension, diabetes, or cancer, I think the risk factor prevalence in the country reflects the trend that we see on the disease. For example, 1 in 3 adults in Bangladesh uses tobacco, either smoking or different form of tobacco. 96% of the population consumes less than the 5 serving of fruits and vegetables that is recommended. The population in Bangladesh consumes almost double the recommended amount of salt. 1 in 5 adults are physically inactive. This figure is
sedentary lifestyle.
Sedentary lifestyle. Yes, this figure is much more when it comes to adolescents. 66% of the adolescents are physically inactive. Very, very worrying trends. And 1 in 4 adults in the population is overweight. 5% of the population is obese. Now, these risk factors, I think, reflects a wider range of issues associated with it. The development that we see globally brings changes in lifestyles, changes in the food habits, changes in the food that we consume. And these are largely driven by commercial interests and also influenced by commercial factors, industry influence from tobacco and food industry. And I think these are gaps that Bangladesh, of course, along with other countries in the region and elsewhere, need to seriously take into consideration with a range of intervention, including policy, legislation, and programmatic interventions to address this trend.
Yes. So at the same time, infectious and communicable disease such as dengue, cholera, tuberculosis, along with the growing challenge of antimicrobial resistance, remain a major concern. How prepared is Bangladesh to manage these challenges, and what role is WHO playing in strengthening surveillance and response?
I think Bangladesh has demonstrated its capacity and ability to control and eliminate diseases. I mentioned earlier, polio has been eliminated in the country for a long time. There are many other diseases that have been eliminated or controlled. Bangladesh, in fact, is the first country globally to achieve elimination of Kala Azar. And these are, I think, demonstrations that Bangladesh can and has the capacity to control or eliminate infectious diseases. However, the current infectious disease situation in the country, for example, if you look into tuberculosis or leprosy, or the rising threat from vector-borne diseases like dengue and chikungunya, I think need a more focused approach. Diseases like malaria, leprosy, or tuberculosis would need a very focused sort of a mission mode approach to make sure that the remaining pockets of the diseases are addressed and diseases eliminated. Whereas rising diseases like dengue or chikungunya need a very different approach. It needs a multi-sectoral approach where the health sector, of course, focus on the health side, but also the other sectors, including the local governments, address the vectors control side of this. Without working together collectively with the various sectors, it's going to be very difficult and very challenging to address these issues. WHO has been supporting the government on providing technical support, capacity building, and also strengthening surveillance and health system to address these issues. Antimicrobial resistance, I believe, is going to be a major issue, not only for Bangladesh, but also globally. We see WHO has been supporting the government to establish and have a surveillance system to monitor the trend on the antimicrobial resistance in the country. And what we are seeing is an alarming level of resistance on many, and including very commonly used, antibiotics in the country. And if this is not addressed seriously, there's going to be a situation where we may have very limited options to treat very common infections. And again, this is an area where the government, the public sector, private sector, and academia, everyone has to work together to address this issue.
Yes. Sir, vaccination has been one of the Bangladesh key public health achievement success. What are the current challenges in the immunization program, and how is WHO supporting vaccine coverage and confidence?
As you rightly mentioned, Bangladesh, I think, is one of the champion countries in terms of national immunization programs, and I think our immunization coverage has been consistently very high, among the highest in the region, and
up to 90%.
Yes, more than 90%. In fact, for many of the vaccines, and this has been a success that is achieved by very strong, sustained government commitment and investment, but also supported by. Financially supported by Gavi, who has played a major role in establishing and strengthening the immunization program in the country, supported by, of course, WHO and UNICEF and other partners. I think the moving forward, the most important challenge is going to be the transition from Gavi-supported program to a fully owned, nationally, domestically financed program, which would happen in 2029 and beyond. I think preparing and planning for that is going to be very, very crucial. Although we say Bangladesh rightfully has been maintaining a very high vaccination coverage, there are pockets in country where coverage is being challenging. For example, in some of the recent national immunization campaigns has shown how difficult it is to achieve very high coverage in urban areas like Dhaka. There are also pockets in the rural and hard-to-reach marginalized communities that need to be addressed, because many vaccine-preventable diseases need a sustained high coverage in all populations. If we leave certain groups of population or certain areas, this is going to be a major risk to re-emerge those diseases. So I think addressing those areas and addressing the challenge of achieving high coverage in urban settings, especially in Dhaka, are going to be important and crucial. We have been providing policy guidance and technical support to the National Immunization Program to address some of these issues, including strengthening surveillance and modernizing the immunization program by digital platforms. And several digital platforms have been introduced in recent past with support of WHO and other partners, which are going to be very, very important to take forward in addressing the gaps that we have, but also making sure that we continue to be a high-performing country on immunization.
Yes. Sir, climate change and environmental factors are increasingly affecting health in Bangladesh, from heat stress to disease outbreak. How is WHO integrating a climate-resilient health approach into the work in this country?
Yes, Bangladesh is one of the most, I think, vulnerable countries, not only in the region, globally, when it comes to climate change and environmental health. Our support and the work that we do with the government is focused on strengthening health system resilience and reducing the health sector's environmental footprint, but also addressing the challenges to make sure that we protect the most vulnerable. We have supported the government to develop the National Health Adaptation Plan when it comes to climate change and environment health. We have been training healthcare workers across the country on rapid response when it comes to issues related to climate change or extreme weather events. We have supported the government to assess carbon emission in health sector, including primary, secondary, and tertiary level health facilities, and preparing a plan to mitigate those. And these are initiatives that have been undertaken by the government with support of WHO and other partners that are looking into addressing the issue of climate change and climate vulnerability when it comes to health sector, and making sure that we have a mitigation plan, but also we have a response plan.
Salinity is one of the major concern in our country.
Yes.
The coastal area.
Indeed, yes.
Sir, one health approach has gained importance in Bangladesh and global also, especially in preventing zoonotic disease. How is WHO working with different sectors to implement one health approach in practice, not just in policy?
WHO works very closely with the Ministry of Health and other ministries who are part of One Health. This includes Ministry of Livestock and Forest, but also the partners within the country and other stakeholders. Together, we have been supporting to undertake joint outbreak investigations. When it comes to zoonotic diseases, these joint outbreak investigation has to be by both the livestock sector and the human health sector together. So we have been working together to support that. We have also been supporting in rapid response training across the country, and integrated surveillance. I think the integrated surveillance is another important area where we also have a strong surveillance system for the animal sector. A lot of time these diseases are maybe a risk for the human sector. So an integrated surveillance system that incorporates animal diseases as well as human diseases are important. We have been supporting these initiatives with the Ministry of Health and other ministries.
One Health approach also important for preventing antimicrobial resistance, sir.
Indeed. Antimicrobial resistance, the usage of antimicrobial or antibiotic in animal sector is a very, very significant factor that will affect the emergence or spread of antimicrobial resistance in the human sector. And that is another area where in One Health we support each other and we coordinate.
Sir, WHO has 6 core functions, including providing technical guidance, setting a standard, and monitoring health trends. From your experience, sir, in Bangladesh, who is of those functions has had the most visible impact on the health system?
I believe we have supported and there has been impact on all areas. But more specifically, I would like to highlight the recent work that we have been doing in the past 1.5 years with the government that focuses on long-term strategic developments.
Yes.
That includes a strategy for health workforce in Bangladesh,
yes,
a health financing strategy, a digital health strategy, and a healthy aging strategy. These are all very important national strategic documents that will look into the system strengthening and having the capacity in the country to address the health issues. We also have supported the government in revising the National Essential Drug List, which is after a long time. This has been revised and updated, and have been working with the government to strengthen the capacity of the National Medicine and Vaccine Regulator, the DGDA, to achieve the maturity level 3 for vaccine regulation.
Yes.
This is another very, very important area for Bangladesh, because Bangladesh has a tremendous capacity to produce drugs and vaccines, and strengthening the National Regulatory Authority to make sure that the quality of these drugs and vaccines that are produced in the country is of the acceptable level is important for Bangladesh to play an important role in this area.
Yes, sir. Sir, access to quality healthcare remains uneven, particularly for vulnerable populations. What do you consider the most significant challenge to achieving universal health coverage in Bangladesh, and how is WHO supporting health system strengthening for universal health coverage?
We have talked about few of these issues earlier,
yes,
including the poor health investment health workforce-related issues. Now, these issues, these challenges have reflected in health service coverage. For example, the UHC service coverage index in Bangladesh is 54 in 2024, which is very low compared to even the regional coverage index. 73% of the health expenditure in Bangladesh is coming from people's pocket. Very high out-of-pocket expenditure.
It's very high in Bangladesh.
This has pushed around 70 million people into financial hardship. Yes. Because they have to either sell off their
land, cattle,
or other belongings to meet the health needs. I think the low health investment is also sort of compounded by poor utilization of health funding that Ministry of Health receives. It's not only a low allocation, but also underutilization. So there need to be improvements in utilization of the funds that they receive, in efficiency within the health sector, but also increased investments in health if we are to achieve high UHC coverage and address these issues. The other challenge has been poor availability of essential drugs and medicines in health facilities. About 50% of the essential medicines are not available in primary healthcare facilities in public hospitals in the country. And that's another issue that need to be addressed. Now, to meet these challenges, we have been working with the government. Some of the support that I mentioned earlier, including the health workforce strategy, essential drugs list updating and strengthening the national drug
295 essential drugs.
Yes, these are part of the support that we are providing to address these issues.
Yes. And sir, we are just last question. Looking ahead, what do you consider the most urgent health risk for Bangladesh over the next 5 years? And how will WHO continue to support the country in addressing those type of issues, sir?
WHO's work in the country will be guided by the WHO's global program of work, GPW 14, which is now for the period of 25 to 28. But under that framework, we will be developing what we call a country cooperation strategy, where WHO, government, and the partners jointly identify the important health issues and challenges and what will be our focus areas in the country. So under GPW 14, we say we support on promoting and providing and protecting health. This includes actually a range of services like health promotion, providing health service, and addressing health emergencies, including the health emergency we have in Cox's Bazar in the Rohingya refugee camps. So these will be broadly areas where we will be focusing on. Some of these details will be developing along with the government, because our country corporate strategy will be developed this year, a new strategy for 5 years. So in which we will chalk out the key areas that we'll be focusing on and working with the government.
Yes, sir. Thank you very much, sir, for taking the time to speak with us. And we truly appreciate your work, your insights in Bangladesh. WHO is doing to strengthen health in Bangladesh. It has been a pleasure to having you with us on behalf of Daily Ajker Patrika. Thanks you once again, sir.
It has been a pleasure, and thank you for having me. Before I just want to emphasize,
yes, sir.
Bangladesh, I think, is in an important moment when it comes to the national development and also health sector.
Yes.
Health, end of the day, is a political decision.
Yes, sir.
And I think we are in a pivotal moment in time where we can take that bold political decisions to make sure that universal healthcare is a reality, that it is the right of the people, and make sure that the incoming and future governments will take health as a top priority in their national development agenda. Because health is an investment. without healthy population, you cannot achieve economic development.
Right.
Without
Human resource.
healthy population, you cannot have a healthy workforce.
Yes, sir.
And without adequate health, you cannot have a young youth population who would get the education that they need, the skills they need for the national development. So it's, I think, very, very important that the public understands this, that all politicians in the country address this issue as a serious national development agenda.
Sir, we wish our future political leader doing good for our country, for our health, for our development. We wish, sir.
Thank you.
Thank you. Thank you very much, sir.